Okay. So before I begin, I would just like to acknowledge that the UBC Vancouver's campus is situated on the traditional, ancestral, and unceded territory of the Musqueam people. I would also like to acknowledge that you are joining us today from many places, near and far, and I acknowledge that the traditional owners and caretakers of those lands. So as Kelly mentioned, I will start the first half of the talk today on living well with Parkinson's, and then Michelle, who's our wonderful physio, will wrap things up at the end with regards to exercise. Now, I do have quite a few slides, so I'll try to get through them quickly. And then, as Kelly said, just try to, if you think of any questions, type them into the chat box at the end there. So living well with Parkinson's, what does it really mean to live well? This talk is really intended for those who have been recently diagnosed with Parkinson's disease and their families and caretakers. So receiving a diagnosis of Parkinson's can certainly be overwhelming, and it might take some people some time for it to sink in. Some may take the diagnosis and feel really empowered to do everything they can to live fully, and others may need more time to come to terms with the diagnosis. Um, and wherever you are in that journey is okay. So I'm hoping that I can share some practical tips today that can help you carry out your activities of daily living and live well with Parkinson's. So we will review building a care team and what that looks like. We will speak on medication adherence and how to manage those medications. And then we will spend a bit of time looking at the management of non-motor symptoms for Parkinson's disease, because these really do contribute to one's quality of life. And a lot of questions that I get in clinic are related to the non-motor symptoms of Parkinson's. We'll touch upon connecting with others and the importance and staying informed. So navigating the Parkinson's journey doesn't have to be done alone. And in fact, patients will do better overall if they tap into a lot of the different resources that are available and all the different disciplines. So whether you live in a remote town up north or here in the Lower Mainland, it would be really encouraged to try to build your team as much as possible, depending on what your specific needs are. So looking at the team approach, because Parkinson's affects so many different facets to one's health, a team approach is really important and can provide that extra support. Now, due to the constraints of the healthcare system, it may not be possible for every single person to be followed by a movement disorder specialist, although that would be the ideal, that would be the goal. You may have been diagnosed by a general practitioner or a general neurologist or even a nurse practitioner in the community and then referred to a specialty clinic. And you may be followed by a nurse practitioner who can, as Kelly mentioned, see patients in between visits with the movement disorder specialist, making adjustments, offering that comprehensive assessment. Nurses can be vital to provide additional support to help with manage motor, non-motor symptoms, educating patients and their family members, and liaise with GPs and NPs. Physios can help with things like range of motion exercises, stretching and core stability, balance training, these sorts of things. Occupational therapists can assist with things like making adaptations to daily routines to make things easier. So that's things like using a weighted utensil for those with tremor, or speaking to you about fatigue conservation and fatigue management. Moving on to speech language pathologists, this discipline can help with low voice, difficulty with articulation, with speech, dysarthria, as well as some swallowing issues that may occur. Social workers can help with family and caregiver support, questions around short-term, long-term disability, employment, these sorts of things. And then it's important to tap into the public health clinics and to see what they offer with regards to PT, OT. Some of them will do home visits. And then there's always the private option as well, if it's feasible or if you have extended coverage for that. So moving on to the medication side of things. For many people, this will be a big adjustment. You would have been, maybe living your entire life with maybe taking one medication a day. Now you're diagnosed with Parkinson's and you might have to take it multiple times per day. So you would have heard from Dr. McKenzie in the last lecture about when to start medications. Now, this is really individual and it's very individual. So with regards to how and when you're going to start medications will really depend on how your symptoms are affecting your day-to-day living and your activities of daily living and your quality of life. So let's say you're started on medications, what does that look like? Generally speaking, if you're started on levodopa, which is the gold standard therapy for Parkinson's, for example, here it says 1.5 tablets at 7 a.m., 1 p.m., and 7 p.m. So it could be difficult to remember to take these medications. You might want to look into using an alarm on your phone or speaking to the pharmacist about blister packing or using a daily dose set. So just trying to see what type of medication administration would be best for you and for your schedule for the day. If you do miss a dose, it's important to take it when you remember. You don't need to double the dose. You want to be prepared for outings, so keeping an extra supply of medications in your car or in your purse can be really handy when you're stuck in traffic for an hour and a half and then you end up being 4 hours, 5 hours late for your medication dose. As it pertains to side effects, so if you're nauseous when you first start levodopa, it can be helpful to take it with a light carbohydrate snack. And then there's also the question around protein and levodopa, which is a question we get all the time. And earlier on in the stages of disease, it's not overly important to really focus on this. The premise is that the levodopa is absorbed in the small intestine and protein is also broken down and absorbed in the small intestine. So they kind of compete for action and the levodopa won't work quite as well. However, as I said earlier on, it's already stressful enough to take medications multiple times per day. So I think the adherence to medications can be a little bit better if you're not focusing too much on the food protein interaction early on. So it's okay to take food with your medications initially. And then creating a schedule for the day can help to optimize your functioning. So you might want to look at your daily schedule and say, okay, I'm going to take my medications at 7. When is a good time for me to exercise? Well, you might want to exercise when the medication is really working for you. So maybe an hour and a half or 2 hours after your medication dose is when you might want to use that time to exercise because you're really benefiting from all that dopamine that you're getting. A lot of patients will find that there's a little bit of a lull in the afternoon where they feel more fatigued, so that might not be the time to exercise. So tips for healthy eating. We get this question a lot. Is there a specific diet for Parkinson's disease? Now, the focus should really be on a well-balanced diet, ideally lower in processed foods, lower in high sugar foods, inflammatory foods. There's been some studies around the Mediterranean diet and the MIND diet. So the MIND diet is the Mediterranean DASH diet intervention for neurodegenerative delay. And studies have shown that this can have promising effects on helping to preserve cognition. The DASH diet was initially introduced to help lower blood pressure in patients without Parkinson's disease. And that's really focusing on a low salt diet, increasing the vegetables and fruits and healthy fats and proteins. However, in patients with Parkinson's disease, we actually often worry about low blood pressure. So just keeping that in mind that sometimes we don't always have to adjust the salt intake. So generally, we want to look at foods that are a wide variety of colors, lots of very nutrient-dense foods that can provide you with that energy and boost the brain power. Lots of legumes and healthy fat, seeds and nuts, healthy oils, proteins are certainly important, especially as we age. So for various reasons, weight loss can occur in Parkinson's, and this can be quite a bit of a concern. So you want to make sure that you're getting enough calories. For many, as I mentioned, there is anxiety around medications as it pertains to levodopa and protein, and some patients may not be eating that much food because they're worried about that interaction. So I think it's important early on, we need you to take the medications, and we also need, eating is obviously very important. You want to look at high fiber foods to help with that bowel regulating, which we'll speak about, and then try to make life easier on yourself. So plan meals in advance. You can try to do larger batch meals, at the start of the week so that you're not having to go to the grocery store so much or cook every day. And then if it's feasible, you can try to get pre-cut vegetables, which may help you in the kitchen to conserve energy if you find that, cutting is difficult. Cutting food is difficult. Now, moving on to management of non-motor symptoms. So there have been several studies that have been looking at quality of life in patients with Parkinson's. And many of these non-motor symptoms can have huge impacts on quality of life. So we'll review just a few of these and the management for each. So we know that sleep is vital for managing mood as well as energy levels the next day. Speaking to your healthcare provider about your sleep patterns can really be helpful to identify why you're having poor sleep. It is very multifactorial, so pain, dystonia, or cramping, curling of the toes can happen at night. Anxiety or laying awake, ruminating about things for hours on end can also occur. And then bladder issues can interrupt our sleep. So setting yourself up for a good night's sleep. These are some tips that we call sleep hygiene. So kind of doing your homework. Are you setting yourself up for the best night's sleep possible? So you want to ensure you're getting fresh air, exercise, and daylight every day. You want to try to go to sleep at the same time every night. Engage in something relaxing before bed to try to calm and reset the body, such as a warm bath, shower, reading, listening to music. You want to limit screen times and limit the electronics in the bedroom. So keeping the bedroom for sleep and sexual activity only. And then, as I said, you want to address any symptoms you're having in the middle of the night, bladder, pain, cramping, and speak to your care provider about that. And then create healthy bed habits. So if, say, you do fall asleep okay, and then you wake up at 1 a.m. and you're just laying there and you can't fall back asleep, tossing and turning, it can be important to get up the research suggests that you should get up out of bed, go to a dimly lit room, do something mundane, read through a boring magazine, not with bright light, don't turn on the TV, don't go on your cell phone. And then once you feel tired, you can return back to bed. And that really helps your body to associate the bed with a place where you sleep, as opposed to a place where you just lay awake and not sleep or ruminate about your thoughts. You would have heard from Dr. McKenzie last week regarding REM sleep behavior disorder. So this is when you have very vivid dreams, talking, yelling, acting out your dreams is very common in Parkinson's, and can affect obviously the quality of sleep that you're getting. So you would want to ensure a safe bedroom environment, declutter, put pillows between partners, move the bedside table away so that you don't hit it. And then melatonin can help. So melatonin is a natural hormone that we all have in our bodies, and this helps our bodies to respond to darkness or for the circadian rhythm. It's known that melatonin can be lower in levels for patients with Parkinson's, so adding on a low dose of melatonin can sometimes help with these symptoms. And then, of course, there are also other medications if it is more severe. So moving on to constipation. Constipation is one of the most common non-motor symptoms of Parkinson's, and we will always ask questions about it at every visit. It's very important because it can affect the absorption of the levodopa, making it less effective. It can also be uncomfortable, cause bloating and discomfort and pain. So the goal really is to have regular bowel movements, ideally every day or every other day, that are easy to pass. So not a lot of straining. That would be a good regular bowel pattern that we would hope for. So managing constipation, you want to increase your fiber-rich foods. These are things like whole grains, oatmeal, flax, hemp hearts, psyllium, lots of fruits and vegetables, bulk vegetables, the cruciferous vegetables like the broccoli and cauliflower and kale. And then there are also natural laxative containing foods that contain sorbitol. So the main one is prunes. Prunes are very good for the bowels and can help regulate the bowels. You can take it in a few prunes a day or prune juice, or some people like stewed prunes. And then step 2 is that you also want to increase your fluids throughout the day and increase activity with less sitting. You want to help those abdominal muscles, help with the peristalsis of the gastrointestinal tract. And then if those natural remedies aren't really working, aren't really doing the trick to allow you to have a bowel movement every 1 to 2 days, then you might need a little something else, over-the-counter laxative. And this would be something like a PEG, like Restoralax or Laxaday, that's very gentle on the system. It's not a stimulant laxative, so can help regulate the bowels without irritating the bowels. And managing bladder problems. So increased frequency, urgency, nighttime voiding, accidents can be common in Parkinson's. So what can we do about it? We want you to drink more water, but sometimes drinking too much water in the late afternoon or evening can keep you up all night going to the bathroom. So try to focus on more water earlier on in the day and less water in the late afternoon and evenings. You should be limiting caffeine and alcohol, especially in the late afternoon and evening. You could try pelvic floor physiotherapy or bladder training exercises. And then we could always refer you to speak to a urologist, a referral to a urologist. There are also medications that can be used that help relax the bladder at night and increase the flow during the day. But it's also important to note that other issues, such as enlarged prostate for men, can contribute to urinary frequency. So just making sure that you're up to date with all of your other health checks is also important. And managing lightheadedness, orthostatic hypotension. So this is a change from blood pressure. Basically, when you go from sitting to standing, the blood pressure drops. And this can increase your risk for falls. So it's very important to bring this up with your healthcare provider. You want to change positions slowly. Sit at the edge of the bed before standing up. You want to try to increase your water and salt in the diet. That will help boost your blood pressure. Maybe buying a portable blood pressure machine, so to check your blood pressure a few times a week could help manage that. You could try compression socks, and then there are also medications which can be prescribed. So moving on to anxiety. Anxiety and depression are very common in Parkinson's disease, and anxiety can certainly make a lot of the motor symptoms of Parkinson's worse, and it can be a bit of a vicious cycle. So oftentimes, for example, patients might have tremor, and going out into social situations can make that tremor worse, which then in turn makes their anxiety worse. So this can lead to more withdrawing from social situations, more isolation, which kind of further perpetuates that anxiety and that anxiety around going into social situations. So we want to try to break that pattern. There is obviously the importance of exercise, which we cannot emphasize enough. Then there are other psychotherapy, such as cognitive behavioral therapy, and this is looking at connections between our triggers and thoughts and actions, learning calming exercises that can help, and many counselors are using this type of therapy. There's also mindfulness meditation, incorporating some deep breathing throughout the day, maybe a few cycles every day of doing some deep breaths in through your nose and out through your mouth, just trying to calm and reset the body. Sometimes people don't like that deep breathing. They don't like mindfulness meditation. So trying to figure out what would be best for you. Maybe you enjoy it, a walk in nature or listening to calming music, whatever it is for you. And then medications can certainly be beneficial, and some of them have even favorable side effects for patients with Parkinson's disease. So mood changes can often precede the diagnosis of Parkinson's by many, many years. And depression can manifest in many different ways, from apathy, lack of motivation, to anger, sadness, irritability, insomnia. I think it's really important to reflect on your mood. And if your mood is down because of a recent diagnosis of Parkinson's or adjusting to this new way of living, that's one thing. But if you've been struggling with low mood for quite some time and it's starting to interfere with your day-to-day quality of life, then either way, it's important to bring that up with your care provider and your care team. If motor symptoms are getting in the way of your activities of daily living, then one might feel naturally down, right? If I can't carry out a certain task that I used to love doing, then I might feel quite down about it. So that's where medication comes in, and the use of levodopa can improve a lot of the motor symptoms of Parkinson's, thereby improving your mood, right? Because the symptoms get a bit better and then you feel better. Insomnia is certainly correlated to depression. So treating the insomnia can also help boost mood. Support groups or speaking to a counselor one-on-one can help with talking through your thoughts, especially if you don't really feel comfortable talking to anyone, your family members or friends about this yet. And then medications, of course, are available. And although there's certainly a place for medications, we also have to do our homework. And those are things like getting an important sleep, getting a lot of sleep, social connection, practicing mindfulness, gratitude can help shift the perspective and incorporate mindfulness into the day. So sometimes we tend to focus on what we can't do, and it's important to shift that perspective into what we can do instead of focusing on our limitations, but rather focus on what we can still do in the day. So just a mindful moment. I like this picture of the rose. So I think this is actually adapted from the Boy Scouts of America. It's called the rosebud thorn theory. When you look at the rose, you look at the rose petals, you can ask yourself, what is something that you're grateful for? What went well today? So it might be at the end of the day, you ask this question and you say, I was able to go on the stationary bicycle for 20 minutes. That's great. Then what is a thorn? What is something challenging that happened today? What could you use more support with? Maybe you found it difficult to do the tightening buttons on your shirt. Maybe you need to ask for help for certain things, and that's okay. And then a bud. What is one thing that you're looking forward to doing? So maybe that's enjoying a home cooked meal with your loved ones, or maybe it's you're looking forward to joining a boxing class for Parkinson's. So doing this activity can really help bring awareness into how you're feeling, helping to calm down the body and kind of shift that perspective from negative thinking to positivity and looking forward. These are just a bunch of other resources available that can help with mood, along with deep breathing exercises are important. Some of these do cost money. I think Anxiety BC is a free resource, as well as Bounce Back and Mood Gym. Social connection. Social connection is very important for our mental health and well-being. Engaging socially will help us keep up to date with current events and challenge us on a cognitive level. So that as much as it's important to be physically active, it's also very important to be cognitively engaged for as long as you can. So make time for those you care about. Invite friends to exercise with you, go for walks. That might also help you to be a bit more accountable with exercise. And then there are some great support groups. Obviously, the Parkinson's Society of BC is a wonderful resource to meet other people with Parkinson's. Lots of different walking groups take place across our province as well. And when you're ready, I think it's important to take time to learn the language of Parkinson's. We use, in a sense, a bit of jargon when we speak in clinic with regards to how the medications are working. So kicking in, wearing off. Some of these terms will be really helpful when you describe your symptoms with your care team and how you're responding to medications. There's an overwhelming amount of information out there, and I think there's also a lot of disinformation. So it's just being cognizant of that and making sure that you're looking at reputable websites. And I like this little comic here. It says, more and more patients are going to the internet for medical advice. To keep my practice going, I changed my name to Dr. Google. So that sums up my part of the webinar today. Just some key messages. Disease progresses slowly over years and decades. We know that exercise and medications can control the symptoms of Parkinson's very well. You don't have to go through it alone. There's lots of support for you. I think it's important to focus on living the best life you can, to be positive and proactive, and know that advanced therapies exist and there's promising research being done. If we can recommend one thing for Parkinson's, it's certainly exercise and helping slow the progression of disease. We want you to start small, set goals, find something you enjoy and can stick with. And on that note, I will pass it on to Michelle, who will delve deeper into that area.
Thanks so much, Joanna. I will share my screen. If anyone wants to stand up, do a little move around. Okay. So I'm going to share my screen here. Hopefully everyone can see that. Again, as Joanna did, I'd just like to acknowledge the land that I'm speaking to you from is the unceded traditional lands of the Musqueam, Squamish and Tsleil-Waututh nations, and I'm truly grateful to be here today speaking from them. So we'll run through information around exercise, and a lot of this won't be new to people. So when we're really thinking about exercise, it's trying to think of it like you would your medications. So sort of the doctors will prescribe medications, or some of you may not be taking medications, but thinking about that routine of trying to get exercise into your sort of everyday life. So today we're going to look at just why we should exercise, when we may consider it, what we may consider doing, how we may go about it, and then where. So the benefits of exercise, we know that exercise improves physical fitness, strength and endurance. It can help to improve functional tasks, such as helping your walking speed, can help to improve your postural stability and really give the foundation for your body's movement. And then sort of thereby helping to sort of strengthen sort of the background for your arm and leg movements. It can help to improve balance and coordination, reducing stiffness, increasing range of motion and flexibility. And it can help to reduce fatigue by sort of increasing your energy reserves there. Can also help to reduce risk of falls, can help improve mood, promote your bone health, and that's with weight-bearing exercise. Can assist with bladder and bowel management, and it can influence brain plasticity, and can also, the research has shown the potential of having a neuroprotective effect, and sort of therefore slowing disease progression. So when should we think about exercising? Really now. Really, we shouldn't be sitting here listening to me. We should be up moving around. If I could do that for everyone, then we would. But yeah, maybe take a moment, give your arms a little bit of a stretch, take a couple of deep breaths, a little kind of twist around. So yeah, sort of making a start now. When we think about exercise, there are many guidelines out there and different things that you can read about. So first of all, the Canadian Physical Activity Guidelines were set, and this looked at how much exercise someone should be doing during a week and the type of exercise. So these guidelines were actually expanded to the Canadian 24-hour movement guidelines. And so the difference that they made with these were that they included sleep and also a reference to sedentary behavior. So the important thing to consider with that is that, yes, it's great that you're doing your exercise. You may be doing 30, 45 minutes a day, but then we don't necessarily want you spending the next however many hours just sitting on the sofa, sort of not moving your body. So it's kind of trying to intersperse that activity and having that movement throughout your day, but also recognizing the importance of sleep, as Joanna has talked about, and trying to get sort of 7 to 9 hours of sleep. And this is for adults who are 18 to 64 years. There are also recommendations for those who are 65 years and older. And again, they follow the same principles. So sort of 150 minutes of moderate to vigorous exercise a week. And this can be in bouts of 10 minutes or more. You don't have to do sort of an hour or half an hour in one go, including the strengthening exercises 2 to 3 times a week. And then when you're over 65, the recommendation is that you also include activities that can help to enhance your balance and prevent falls. Again, these were expanded to include sleep and to reduce your sedentary behaviors. So you don't want to have any more than sort of 3 hours of recreational screen time, if that's possible. I know we all maybe sort of binge watch certain shows sometimes, and once in a while is okay. But even in that, just trying to make sure you're getting up, moving around, that you're sort of not sitting for that prolonged amount of time. Obviously, if you're working and you're in an office or at a desk job, again, that may be a little bit more difficult, but taking those opportunities to stand up, take a little break, walk around, if you're able to. The Parkinson's Foundation has taken on sort of a visual of the recommendations as well, and they have incorporated the recommendations around agility and multitasking, so adding in that sort of cognitive and physical task together during exercise in making it more specific to people with Parkinson's disease. Obviously, with any of these things, you want to make sure that you are safe and able to safely carry out these activities. And so looking at this balance between aerobic activity, strength, balance and agility, and stretching. Parkinson's Canada has its own format of this, and they also give you a little kind of to-do list and way to record that. And then the Parkinson Society of BC, Shelley, the physio, put together an amazing exercise booklet here, which you can access as a PDF or as a physical copy. And again, has lots of good information around exercise, actually exercise that you can carry out, and then a diary and ways to kind of track your progress as well. The Michael J. Fox Foundation has this new guide, and this has a lot of information in it. It is a fairly lengthy document, but a good read. To be able to access it, you just have to provide your email, and then they provide you the ability to download the booklet there. But again, a good amount of information if you'd like to read a little bit more around the importance of exercise for brain health. So when we think about what exercise we want to do, as everyone says, it needs to be something you enjoy. And yes, there are various research studies, papers out there that may recommend one type of exercise more than another. There may be references to aerobic exercise, there may be references to cycling at a certain RPM. But overall, it's got to be something that you enjoy so that you're consistent with it. And for me, anyone that comes to see me in clinic, I really talk about the consistency as the key, because you may start off on a good trajectory, and the first couple of weeks you're going and you're really motivated, and then that may wane because you're doing something that you're not really enjoying. It's maybe something that someone else told you that you should do. And so it's trying things out, maybe trying different things out and seeing what fits in with your lifestyle, what fits in with your body and your interests, and what you're able to carry out safely. So we do want to look at that balance of trying to build in a balance of aerobic activities, strength training, balance and agility, posture and core, and flexibility. And posture and core is one area that I, again, spend quite a lot of time in clinic talking about, because often people are good. They're kind of set with their aerobic activities, they're set with their strengthening, but there may be little things that they're missing. And posture and core is really important for providing that foundation. And I really talk about it as if you think about a structure of a house. You need a really good foundation before you put your walls and your roof on. And so for your body, you need that foundation, that central foundation in your core, to have really good effective movement in your arms and legs. So options for exercise, there are lots that are Parkinson's specific, and you may have heard about these. You may be joining in with some of them. We've got the Parkinson's Wellness Recovery, and that's based from Dr. Becky Farley down in the States. We've got Rock Steady Boxing, Dance for PD, which has worldwide accessibility, PD Warrior from the US. We've got Pedaling for Parkinson's, and the LSVT Big and Loud. We may also consider things like the meditation, yoga, getting out for walks, maybe swimming or aquafit, looking at Tai Chi, and pickleball. I think pickleball is one activity that has really increased in popularity, and I know in certain areas there have been classes, pickleball for Parkinson's. So maybe look out in your local community and see what's there. And if not, maybe connect and try and start something. Often when people show an interest or voice an interest, that's maybe where someone gets an idea to then start a group. So things we need to consider when we're thinking about exercise. So are you already exercising but need to consider a different type of exercise? So that's where I talked about maybe you're doing lots of aerobic exercise but need to, consider maybe more balance or maybe a little bit more strength. You may be new to exercise or have other health conditions to consider. And that's important. So if you have any joint conditions, as much as we know that we want to have sort of a moderate to vigorous, intensity for exercise, we do need to be respectful of our bodies and what they can tolerate. So you can complete the PARQ Physical Activity Readiness Questionnaire, and I have a copy of it in a couple of slides to show you, and that just helps you to identify any other health conditions that you may need to consider. And there may be certain things that get flagged that then require you just to consult with your doctor. Some exercise groups may ask you to complete the PARQ or maybe an ePARMEDX form. Not everyone does, but maybe particularly if you have any heart conditions or lung conditions that the doctors may want you to be mindful of your heart rate or blood pressure when you're exercising. So those are things that exercise professionals would be keen to know, so they can help you manage that within your exercise sessions with them if you are meeting with someone. So you want to think about frequency, intensity, time, and the type of exercise. So we've talked about types of exercise. I know Joanna mentioned the timing, and if you are on medications, then we do encourage you to exercise during that on period, but also finding a time of day that works for you. So if you do experience some fatigue, then obviously not when you're experiencing that, but it may be fitting in with lifestyle. So it may be fitting it in with work or family, other commitments. So it may be that you don't have an hour to spare, but you have, 3 sets of 20 minutes during the day, and that's okay. You can definitely split exercise up in that way. Intensity, the research does definitely recommend more towards the higher intensity, sort of moderate to vigorous or high intensity exercise if possible. But again, it's if that's safe for you to do that as an individual, and your level of moderate to vigorous intensity may look different to someone else. And that's generally we look at the way you find that is there's a calculation where you minus your age from 220, and then you will look at, for moderate exercise, it's sort of 60 to 65% of that number will give you the heart rate that you want to aim as your target. And for a higher intensity, it's 80 to 85% of that. Now that is different if you are on any medications that affect your heart rate. And so that is something you'd want to discuss with your doctor directly. And frequency, really, I know I've gone through this backwards, sorry. Frequency, we really want to try and be consistent. So if that means that doing something every day helps you build that consistency, then that is what you aim for. If you're not able to tolerate activity every day, that's okay. And so is it that you do exercise every other day? But it's being true to yourself and really knowing what will work best for you. Ideally, we want to be moving every day. It may not be an extreme kind of higher intensity exercise that you're able to do every day, but you may interchange that with maybe doing some Tai Chi or some yoga, something that's a little bit more sort of lower intensity to give you that balance. You definitely want to pace yourself, build up gradually as you're able to, and it should challenge you both physically and cognitively doing those dual tasks if it's safe for you to do so. So you want to think about your preferences. So do you prefer to do something yourself at home, or do you prefer to be out in the community doing something with someone else? That may be with a friend, it may be as part of a group. You want to try and incorporate exercise into your daily routines. So again, building it into your schedule, building it into the structure of your day, setting yourself goals as to sort of what you may want to achieve, whether it's walking a certain distance, whether it's participating in a certain activity. And you may want to use technology to track your progress. Many people now will have smartwatches or have their phones which track their steps. So again, it's if that works for you, then that is a good sort of way to keep yourself accountable. You do want to have a backup plan for your off days. You know, none of us have perfect days, day in, day out, and we want to kind of ride the waves a little bit. So where you may have a plan to do something, but your day isn't going to plan, then maybe there's something different that you could do. So instead of, you know, doing an exercise class, maybe you do a shorter walk that day that's a little bit less intense. But it's really trying to not give up on something completely, but just modifying it as you need to. Again, it's sort of seeking support, as Joanna mentioned, sort of from your family, from friends, and from professionals as well, be that a physio, a kinesiologist, personal trainers, fitness instructors, whoever you may have in your community to help you support your exercise program. You want to ensure safety, and that is key. If your body senses fear in activity, then it will respond to that, and you'll be less able to make those sort of full body big movements that we really want to encourage. And so ultimately, we want to try and have fun. And not everyone finds exercise fun, and we get that. So again, it's finding ways that you can try and make it fun. So it's maybe you include grandkids or your kids, or moving, exercising with a friend, being out in that social environment. This is the PARQ. It's a lot of information on here. It's one of 4 sheets, but that's just something you can find online, and you could complete just to kind of rule out if there's any red flags for something that you may want to discuss further with your doctor. So thinking about community resources for exercise. So the Parkinson Society of BC has some amazing resources. So on their website, they have access to different regions, and then you can click on that region and find out what may be available in your local area. They also have sort of in-progress sessions of live classes, and also pre-recorded exercise videos that Shelley has made over the last few years. The BC Brain Wellness Program is a program that looks at both exercise but also incorporating other activities for brain wellness. Most of these are online, and they also do a Wellness Wednesday where they have guest speakers come in, and just a good connection. These are all free, so accessible sort of across the province. NeuroFit PC is a private physio practice, but Naomi has been very passionate about delivering services to people with Parkinson's, and has created online exercise videos that are available free of charge. But she also provides in-person and online classes. The Parkinson's Wellness Project is something available on the island, again, providing exercise options there. If you do want to find a physio, then you can go to bcphysio.org and you can click on the Find a Physio button. And usually in the area of practice, I would encourage you to choose neurology, and that will bring up any physios within your area that have an expertise in treating people with neurological conditions. There may also be different programs at community centres. So there may be fitness instructors running groups for classes specific for people with Parkinson's. And then just some coaching resources. It is sort of an area that many people do struggle with in having that accountability and keeping on track with things. And so these are a couple of options that are available. So Healthy Steps is a free virtual sort of or in-person lifestyle program. And again, it was based out here at UBC, but being online, it can be accessible. And that's for 6 months. And Choose to Move also provides a 6-month approach for anyone 65 and older that wants to become more active. You can also connect with HealthLink BC, and you can call 811 to try and connect with a qualified exercise professional. Other online resources that we have, so U-Turn Parkinson's is based in Winnipeg, and they have classes online that you can access. Dancing with Parkinson's Canada, again, has classes online. Parkinson's Canada has exercise classes. Dance for PD has global classes, and they actually have classes in different languages. So I was looking recently, and they had a class in Mandarin, which for many of our clients would be useful. And then PD Warrior is again based in Australia. They, as far as I'm aware, they don't have any free online resources to participate in their exercise, but you can subscribe to their challenges and their classes there. In the US, we have the Parkinson's Foundation. Across the pandemic and ongoing, they did Fitness Fridays, so they have a wealth of exercise videos as well as the Brian Grant Foundation has a lot of workout videos. The Davis Finney Foundation has Pedaling for Parkinson's, and there are groups out there now. There has been one in Vancouver that has recently started this year looking at pedaling for Parkinson's and trying to encourage that pedaling at a certain rate. And then we have Power for Parkinson's, another online exercise group. So key messages from my little session here is that really trying to consider your exercise just as important as your medicine. Trying to be as consistent as possible. Choose a variety of exercise activities to make it sort of more enjoyable, and also have fun. And so with that, I'd like to thank you for listening, and I'm going to stop sharing if I can. Okay, 1 second. There we are. Sorry. All right. So I don't know if anyone has any questions. Feel free to pop them in the chat if you do.